Elbow pain is a common condition and it can affect many people. It can affect your ability to do simple things around the house like pouring from a kettle, and it can affect sport as well. Now, if this condition is persisting with you, there may be some nerve involvement. So stick around, I'm going to show you how to test yourself and also how to fix it if you've got some nerve involvement. So if you've got elbow pain, the nerve that might be most affected is the radial nerve. Now this nerve passes from the neck and it goes down the outside of the arm. And because it runs very close to the tendon that's most involved with tennis elbow, it can become irritated and not move properly. And nerves need to slide and glide for normal function to happen. So that's really important that we have that nerve moving. So how do we test if your nerve is involved in this condition for yourself? Well, there's a fairly simple way to do this. I'm going to sit down for this, and what I'm going to ask you to do is to take your thumb and move it across the palm of your hand like so, and then curl your fingers over that thumb. Now I'm going to ask you to turn your arm around like this and bend your wrist back. From that position, I want you just to lower your shoulder a little bit, okay? So your arm's by your side, and then what I'm going to ask you to do is just raise your arm out to the side, just straight out to the side, and note anything that you feel, such as pain in the elbow or any tingling or pins and needles or anything like that, and stop at that point, okay? You might also notice it gets a bit harder to move, and you can stop at that point as well. Now, if you take the pressure off the nerve, that should make it easier, less symptoms, and you should be able to move your arm a bit further up. Now what you want to do is compare that to the opposite side. So the same procedure and raising out to the opposite side, the good side, and compare how far you're getting up. Now, if you can get up further on your good side before you get any symptoms or resistance, it's most likely a positive test for the nerve. Okay, so how do we fix that? Now, we can do what's called a slider. So a slider is where we get the nerve to slide through its course of action and around various structures. So to use a slider for the radial nerve, what I'm going to get you to do is do the same positioning, so the thumb across, hand over, fingers over the thumb, and then take that out to the side, turn the palm around like this, and what you're going to do is you're going to move your neck to the side as you raise your arm to the side and then back, and then repeat. So sliding the arm up, and at the same time you're flexing your neck towards that same side. Now you might want to do about 6 repetitions of this, and you can do this about 3 times a day. Now the important thing to remember with this is that you don't want this to make your problem worse. So if you actually feel more pain afterwards, you're not doing correctly, and it may be too provocative to do. The other thing you can do to see if this is helping is to use a grip test before and afterwards to see if that's made any difference to that test. And you know, if you've done the nerve exercise and you can grip better, you've made some improvement. Now, if this doesn't help and you are totally confused and your symptoms are not improving, there might be more that's going on, and you might need more detailed assessment and treatment. So feel free to contact us at the clinic or message us below so we can help you further. Bye for now.